And name is Alfred Williams with a brother's voice, where our motto is increasing the depth of our voice, but not the volume. Okay. I'm a psychiatric nurse practitioner, family nurse practitioner. I've been in healthcare for over 30 years, starting at 18 years old in the U.S. Navy as a hospital corpsman. And over those years, one of the things I realized, one of the things that I feel really strong about is healthcare with men, and specifically African American males. Identifying the disparity of care with African American males is very important. So this is one of the things I want to address. Definitely want to address that because as much as I do studies and I read research, we don't read much research. There's not a lot of research on African American men, specifically mental health issues associated with African American men. And the first thing we want to talk about is depression. Our first podcast, we really want to kind of dig in a little deep and talk about depression. Depression, most people can identify as having a sad mood for a period of time. Some people for long periods of time, some for short period of time. But depression is one of those things that we really can identify is a problem with most people in the community. And it's something that's generally transient, so we don't really get too up in arms about it. Let's talk about it. We're going to first talk about some of the risk factors that can occur with depression. One risk factor could be acute stressors. Acute stressors could be something like a divorce, loss of a loved one, change in the job, loss of a job, any stressor that could initiate and cause a person to change their mood. And there's many different things depending on the person that could cause changes in the mood. Another another one would be family history. There's a term we use, a medical term, familial tendencies. Many times when we ask questions and get a history of patients, we always ask about their family history. What occurred, or did their mother have a history? Tell me about your mother's mental health history, of medical history. Tell me about your father, paternal side, family history. It's important to understand. Now, there's not a genetic link, but in many cases, if it's familial, if the mother have it, the father have it, there's a high likelihood that the children may have it as well. Okay, and also we talked about social history, but we're going to mention that a little more. Social history identifies the lifestyle, the things that they deal with as far as the stressors, drug abuse, trauma that occur to them at a certain age, especially in childhood, or even as an adult, depending on the circumstances that could affect their mood, that could really ultimately affect their mood for long periods of time. Let's talk about some of the symptoms of depression. Specifically, now we're going to identify the normal symptoms or the criteria symptoms with the DSM-5, which is what helps medical providers and medical healthcare workers to identify a diagnosis. The first criteria that I'm going to recognize will identify as fatigue. Many times they don't have much energy, they're tired, they're fatigued. Another one would be inability to concentrate. Another one, we're going to say, next one will be, how do you feel about yourself? Many times people that's depressed will say, I feel worthless, I feel guilty, I feel hopeless. Another criteria would be your interest. What do you like to do? I used to like to play basketball. I don't even like to, I don't even, when the last time I played basketball? It's been months since I played basketball. That's something that you enjoy doing, but you hadn't even found the time or had the energy to do it or even had the interest. Another one, eating patterns. Many times people, when they get depressed, some people binge eat what we call comfort eat more, where others, they don't eat much or very little. What about the sleeping patterns? Some people sleep excessively, the other people don't sleep much at all, may get 2 or 3 hours of sleep a night. We also want to find out do they have any thoughts of wanting to harm themselves or suicidal ideations? With that said, those are general criteria for the diagnosis of really it's major depressive disorder. But let's flip it over and look at it from more of a male's perspective or male symptoms. First, in many cases, men generally turn their depression outward. So they may provide symptoms of anger, irritability, aggression. Instead of even, of course, you're going to ask, do you have thoughts of wanting to harm yourself? In many cases, they may have thoughts of wanting to harm themselves, or they may have thoughts of wanting to harm someone, homicidal ideations. There's a term I asked about, identify was, how do you feel about yourself? That's a term that's important because I find with many African American males, with the dynamics and the things that's around many men, African American males in particular, there's a sense of stress, there's a sense of pain. And when you look at local media, not just local media, but media in general, you tend to feel, and myself included, sometimes you feel a sense of decreased self-worth. We've seen, in the case of African American men being killed right in front of us with hands up, or while they are on the ground being choked to death. We've seen that. We've seen people get shot, and seeing those things really tend to give you a sense of decreased value. I remember during the Rodney King incident where they was beating him and they was hitting him with billies and they was saying, keep still, keep still. And my thoughts was during that time was and I talked to, because I was in school at the time, I talked to Caucasian people, friends, white friends that I had, associates, not that I don't have white friends, whatever, I'm getting that story, because we all get along. I take people as they are. But my point is, they said, well, if he would have just listened. But this is what always came to the front of my mind was, if you would have seen 10 men beating a dog with a billy, how would they have taken that? How would they have taken it? It would have been an uproar, excuse me, when you consider them beating an animal. It could have been a dog, could have been a cat. Now, think about the value, what that tells me is that they value an animal more than they value a man, a human being. I don't care how you cut it. You can't get away from that. Okay. So I'm saying that in just the terminology, even being an African-American male, talking to other men, even when I was young, many, not all, many had a decreased sense of self-esteem. I'm not going to say a feeling of worthlessness, but a decreased sense of worth compared to the general population. For example, I remember being in the military talking about, when I get out, I want to go to school, I want to do such and such. They ain't gonna let no brother do that. I heard conversations like that. I heard Black people say, oh, you can get your education, you're just gonna be an educated fool. I heard all that kind of negative things. No one would sit down there and say, not no one, many would say, okay, that's accomplishment. You could do anything you want to. Very few times I've heard that coming up. And I come from a family that, besides my immediate family, and I'm talking about mother, father, I didn't hear a lot of positive about what you can do. I heard a lot of negative. Niggas, they don't let niggas do this. They don't let niggas do that. Niggas can't do this. That's a white school. You ain't gonna be able to make it there. All that kind of stuff. Now, people say, well, we hear that all the time. You hear it all the time, but it affects you. It affects the especially African American males. I heard a person say one time, if they needed a good coach, they need a white coach. What kind of statement is that? So you're telling me that only a white man can lead. So all that to say, many times when you talk about how you feel about yourself, one of the criteria for evaluating depression self-worth, self-esteem. Those things stand high. I'm not saying every African American male deal with that, but let's be truthful and look at it. I think many of us deal with that battle of how we are perceived, how we are treated, and how we almost expect to be treated less than. But that's a discussion that we could talk about another time. And I might have a couple of other gentlemen on there so we could kind of discuss it, do like a round robin and talk about it more. So recapping with signs and symptoms with depression, again, men specifically with African American men, but men in general, they turn their depression outward. They turn it outward many times, and it might exhibit itself with depression, as far as anger, aggression, drug use, other coping mechanisms that men may use. Could be a number of different things, but it could be something that is a coping mechanism, such as it could even be violence, it could be sex, it could be a number of different things that's used when you don't feel good about yourself. I've heard people say, we'll get on to that. I don't want to go too far over that, but I know gentlemen that I grew up with, and even adult males that would use sex as a manner of validating who they were as men. That's another tough topic, but so don't equate the maleism that many African Americans use. I'm strong, I got this, I got that, and don't always account that for confidence. Count that many times as a coping mechanism. Many times the person that always have to say what they have or what they are, what they got, many times those are the people that had a poor self-esteem. So those are some of the symptoms that associated with depression, signs and symptoms with depression as far as with males. I do want to make also another thing that's very important. Depression can affect you physically as well as spiritually, of course, mentally, especially if you suffer from depression over a period of time. From a physical standpoint, if you have chronic disorders such as diabetes or hypertension, depression can make it much worse. Make blood sugar elevated, can make blood pressure high. If you have, it could cause your immune system to suffer. Many times under stress with depression, many times that puts you at risk for opportunistic infections, colds, whatever it may be. But also, if you want to think about it, it could put you at risk from being demoralized emotionally. I'm trying to think of any other things that I would want to say. Those are some of the bigger ones, though. Those are the bigger ones that I would want you to know. Going a little bit further down the road, if depression is really bad, you have concerns about suicide, self-harm thoughts. Many times when a person is depressed, they have this reckless attitude that, and I'm generally speaking more with men, where their activities are reckless. They don't really care. Alcohol, drug use, and they could be kind of impulsive. And I'm not necessarily going into another disorder. I know a lot of healthcare workers will say, well, you might be talking about bipolar. With men, impulsive actions could be a sign of depression, anger, and that's a way, again, a coping mechanism. Culturally, if you come out of a culture where you have to stand up and you're used to expressing yourself certain ways, especially when you're angry, that could be a norm. So, okay. So those are some of the effects over a period of time. Let's look at some of the barriers of care and some of the reasons why many times men, specifically African American men, don't come in to get care. First, the stigma. When you look at the mental health disorder and you say, I'm dealing with depression and I had to go see someone for help, the stigma of having mental health disorder, what, you crazy? I wouldn't be surprised. I know I have friends right now. If you said, well, I think I'm gonna go see a psychiatrist. Why, what's wrong with you? You crazy or something? And it sounds like a joke, but it's insensitive. But we still We're better than we was 20 years ago, but we still have a long ways to go. Especially, I have to speak on my own culture. We have a long ways to go with being sensitive to people's mental health. So stigma is another one for men. Another one is inability to truly identify feelings. This is a tough one because we really, as men, and specifically Black men, due to our approach on masculinity, especially old school, it's a little different now, and the newer generations, the millennials, and so on and so forth. But I know I'm a Gen X, so when I think about it, though we would not want to show weakness, so we did not talk about things that made us feel vulnerable. So to get past that barrier, how you doing? I'm good. I'm good. Getting past that barrier to sit down and say, really, right now, I ain't doing that my best. Now, I'll be the first one to tell you, you ain't gonna tell that to anyone. You have to have people that you feel comfortable to talk to about that. But at least having that system, a support system of people that you feel comfortable to talk about it could be a big help. But because that inability to truly identify feelings and the willingness to explore your own feelings and identify why you're acting the way you are, what could be the root cause, this could be a major issue, and this could be a major issue that could cause major problems and prevent us from actually identifying that we need help. Last barrier I want to talk to you about is cultural masculinity. Cultural masculinity. African American men definitely. I read a research article one time that's talking about mental health and men that suffer from trauma. And they said one of the major problems when identifying feelings and talking to them about concerns is that African American men took masculinity to a whole nother level compared to Caucasians. For example, ultra masculine, and I think a lot of that come from what we had to go through, our history as far as coming into this country, beaten, not really being identified with being a human being and treated like a human being. So many times we embrace masculinity as not showing weakness, not showing emotions and stuff like that. But it could be very detrimental when dealing with mental health. And it could be a major barrier to getting the care that you deserve. So let's talk about interventions. Interventions could be just having a support system. I know every male, specifically many African American men, will not say, I'm going to open myself up to go to therapy. I already know that. I worked in this field long enough to know that. But they may be willing to talk to their pastor. They may be willing to talk to a good friend. They may be willing to talk to a coworker, a family member, an associate that they feel comfortable and that feel willing to hear them. So whatever that may be, whatever circumstance or whatever, that's a support system. We need a support system. We as African American men need to support each other more. There's one group of people that is very difficult to reach out to because we're so closed in our feelings. And in many cases, we don't talk about as much. Many cases, we don't. And this, I believe, comes from indoctrination to coming to this country and being divisive. And during this indoctrination from white man to African American men, many times we've learned and we had a certain disdain or distrust for each other. I remember reading portions of a Willie Lynch letter, and they talked about use their differences to cause them to have a division. And with that division, basically, I'm summarizing, of course, you could control the whole group. And we have that with colorism. We have that with socioeconomic. Some families that want to be different from the other families because they may have more money or whatever it may be. They may be in a different class as far as financial class. So many times, I know I kind of rant, but many times we really have a distrust and we really need to work on that. So having the ability to talk to a person that know your experience, going to a psychotherapist, meaning going to a counselor, will be helpful. Going to a pastor if they are proficient in counseling. Just because a person's a pastor don't mean they're a counselor and they could do spiritual counseling either. So, be mindful, be mindful. And then also identify maybe you need to go to a psychiatric nurse practitioner to get on a medication management program to kind of help balance your neurotransmitters so you won't have that depressed feeling. Because many times that's what we use in combination. We'll give antidepressants, and I would always suggest therapy if there's some lingering trauma or some issue that's unresolved. So those are the interventions. One of the big solutions that I would like to throw out to our community is the willingness for us to have mentors and mentees, be the older men talking to younger men. Younger men open themselves up to respect older men and not thinking they know and listen and grow. Both have a lot to learn. I would love to be able to talk. I have a son. He's going to be 20 soon, and I have a nephew, and he's 17, going on 18. So I enjoy listening to them and learning. Now it's a whole different culture than it was when I was growing up, and I'm going to be honest with you. In some ways, I could relate to a 55-year-old white male better than I could relate to a 22-year-old African American male because culturally it's very different from the culture that I grew up in. But I would like to learn more about it, and I would like to see what parts I could do to make a better community that I live in. Okay. But that's my voice for today. Thank you. Look forward to hearing the comments. I look forward to continuing this conversation next go round. Peace.